Can you please give a brief introduction for
Okay.
yourself?
My name is Professor Tajudeen Ayodeji Olasinde. I'm a consultant radiation oncologist. I'm professor of radiation oncology at Ahmadu Bello University, as well as Ahmadu Bello University Teaching Hospital, both based in Zaria. We are here for the 17th conference of the Hospice and Palliative Care Association of Nigeria. The Hospice and Palliative Care Association of Nigeria was founded in 2007. Our first meeting took place in Abuja, March 2007, 28 precisely, uh, in conjunction with a lady called Dr. Anne Merriman, late now. In fact, will give us the seed money. And what is Hospice and Palliative Care Association of Nigeria? This is an association which is a multidisciplinary team of all health medical personnel involved in the treatment and rehabilitation of patients suffering from life-threatening or life-limiting illnesses such as cancer, chronic diabetes, sickle cell diseases, and other chronic illnesses, who are suffering from pain mainly and other symptoms. We are involved in relieving symptoms in patients that are suffering from these diseases that cannot be cured again, but who have been diagnosed. So it's not actually for end of life care. End of life care is part of palliative care. So palliative care is from diagnosis of the disease up to the death of the patient and bereavement. So palliative care involves the patient, the family, and the carers. So you can see the difference. We are not just focusing on the patient or the disease alone. We are focusing on the patient as a whole and the family and the carers. And what we want to do is that even when we know that this patient cannot be cured, we want to improve the quality of life so that the patient will be dying pain-free and patient will be able to relate well with people in the surroundings.
Thank you very much, sir. So for 17 years, you've been in this. Now you've walked us through the journey. Now, from your wealth of experience, can you please share one of the most serious cases you've handled? The most serious cases you've handled successfully and how it went.
Thank you very much. I will tell you the most serious case I personally have handled, and not because this is my field. I'm an oncologist. It's a cancer patient, an advanced cancer patient, and a breast tumor in which the patient have swollen arm, which we call lymphoedema. The tumor was already spreading. And with this radiation treatment that we gave and chemotherapy, patient was improving gradually. But the most fascinating aspect, even when we know it was an advanced case, a stage 4 disease, no longer curable, we are able to relieve the patient's pain. We were able to control the pain. Even when this patient was going down, when the patient was going to die, she was able to smile. She was able to have fruitful discussions with the family. We allowed the family to come around him and around her, sorry, and the patient died pain-free, which I will say this is one of the most serious cases I've attended to.
Okay, as a palliative caregiver, now, how have you been able to navigate the issues of loss of empathy that is rampant now among health professionals in Nigeria? How have you been able to navigate, to manage, and how do you intend to cope with it?
Thank you very much for that question. If you notice in this meeting, we have varying multitude different professionals in the healthcare profession. You have the doctors, the nurses, the pharmacists, physiotherapists, social worker, all, and we call it a multidisciplinary team. Even we have volunteers, and this is part of it. For you to be a member of HPCAN, Hospice and Palliative Care Association of Nigeria, the first thing we imbibe in everybody is that you must have the passion, you must have the willingness to see, listen to the patient, treat them accordingly, don't overdo things, even when you know they cannot uh, uh, recover fully, but make sure that you treat them with empathy. Take care to listen to them, know how they are feeling every day. And by the time different disciplines in the healthcare profession, they are involved in managing a patient is far, far better than a single individual doing everything together. The nutritionist will come and see how the patient is performing nutrition-wise. The physiotherapist, the patient that have been bedridden for about 1 or 2 months, they want to see how they can encourage, how they can be mobile again, maybe by doing some physical exercises. You see different kind of professionals, not only the doctors, not only the nurses, and even not only the pharmacists. I will encourage viewers to keep on watching Cordial Compass TV, which is the Niger First Medical Travel TV.
Thank you very much. So good to have you.
It's a pleasure.
To have a lovely evening.
Okay.